Así que quiero invitar a subir al escenario a los participantes del foro número 6, Salud y Seguridad de los Consumidores, Medidas Preventivas y Estadísticas, Bases para la Evaluación y Toma de Decisiones, Gestión de Riesgos, Fuentes de Datos, Problemas y Buenas Prácticas. Pasen adelante, por favor, los participantes de este foro. El foro será moderado por el doctor Jorge Pacheco. Él es médico cirujano y especialista en medicina familiar de la Universidad de Concepción, académico del programa de salud y medicina familiar de dicha institución. Como jefe del Departamento de Estadísticas e Información en Salud, el DEIS, del Ministerio de Salud, se enfocó en restablecer la confianza pública en las estadísticas sanitarias y promover una perspectiva regional de los datos de salud. Adelante, Jorge.
Please, Jorge, proceed.
Hola, buenos días.
Can you hear me? Yes. First, I would like to thank for the invitation. We, as a statistic department, have generated a great deal of the Ministry of Health, but we're not very involved in the regulatory aspects, but we do believe this information can be used for that. And in that sense, we are very interested in promoting and the best use and proper use of the data for the various aspects. So in that sense, we thank you for the invitation. I know we have little time. I will present the panelists and then we'll continue with this conversation. In relation to the first presentation, the presentation is called Tools for the Improvement of the Security and Consumers. Silvana will present. She's the director of the Directorate of the National Entity of Consumers Protection and Peru. She's master's degree. She has specialized in administrative law, consumer protection, financial right, and Katia has experience in public and private service, National Authority of Protection to the Consumer. She has conducted activities in the specialized room for protection and the procedures to the consumer. At present, she works as the director of the Authority to Consumer Protection, and she has assumed the National Secretariat of the Council for Consumer Protection. She's also a professor at various universities in INDECOPI, particularly in matters of consumers protection. I understand she'll do her presentation virtually.
Hola.
Yes, we can hear you perfectly. Good morning, everyone. I'm going to share my presentation. Can you confirm you can see my screen? Okay, we can see your presentation. Thank you very much. Good morning. Katia. Please show your slides in presentation mode, please. Okay, that's better. Thank you very much. I would like to congratulate CERNAC for the organization of this event. Unfortunately, we haven't been able to be there in person, but we are very pleased to share with you this space of learning for everyone in order to find the improvement on the conditions of the cybersecurity of consumers, of safety of consumers. During my presentation, I will share how INDECOPI, with an alert system and products and dangerous services, uses various tools to improve the consumer's protection and use measurements to promote a continuous improvement. Before referring to the detail, I would like to give you some context on how this works, what the characteristics of our management system of products alert, dangerous products alerts is. In Peru, when a supplier detects that the product they place in the market presents some type of risk, unforeseen, or let's call them unpredictable risks for the safety and health of the consumer, they are obligated to mitigate the risk, to apply measures to mitigate the risk in a immediate deadline. Within those measurements is to inform consumers and the other suppliers part of their change in no more than 5 calendar days. And additionally, they have to inform the INDECOPI in no more than 5 working days. Besides, they have to inform the measures to be adopted to correct the problem, whether this is a total recall of the product or any other measurement according to the nature of the risk of the product. Our alert management system starts with the communication by the supplier. Although it's not the only way of information or source of information, at present authorities and competitors for the issue of alerts, even the communications issues in international portals such as the case of global recalls, OECD or the CR from the network. They are very useful to start our inquiries or investigations and notify those cases requiring the issue of a national alert. We can see in great interest at initiatives such as the one for CERNAC and other countries to collect information of consumption accidents directly from hospital. This has motivated us to start investigation to determine whether it is proper to add more stakeholders from the healthcare as source of information to specifically identify the ones we should work with. As you can see, the process we have today, the information is managed internally and is published at the consumption portal and replicated in the channels we have at our disposal, such as our regional offices, which to date are 45, social media, CR, and also we have some allies such as the Fundación o Transitemos Foundation. Trying to improve the effectiveness of the improvement, we have initiated the tracking of the alerts published in order to know their progress in the implementation of measurements, and it is also important to receive feedback by the suppliers to identify what is the thing we can improve in the system. It is very important to us because the primary goal of this alert system is to provide timely information to the consumer in order to prevent risks in the product. Then any modification, any efficiency measure in terms of time, of scope is welcome irrespective of the source. Then, by having introduced the topic, I will tell you about the tools to improve the consumer's protection. Between 2012 and 2023, 720 consumption alerts were issued. This is 10.9 million people considering the involved areas. In 2024, so far, this number has been improved, reaching 120. The alerts were initiated after the communication by the supplier. The main line of business being alerted to us is the automotive sector. This is important because it's giving us some evidence on what's the sector where you have the information asymmetry gap, the most important one. And that implies that it will require more actions from us. And this is why we have identified some opportunities to improve, and one of those is the cooperation with the Automotive Association from Peru, and we already have an agreement, and we are about to launch a technological tool for a more simple pursuit that might be object of a recall. I have told you that we usually do monitoring activities, allowing us to identify cases where it has been necessary to publish an alert. The supplier has told us directly these cases are 18% of the published alerts. Irrespective of that, we see the need for exploring more and more other product categories because the challenge is to reinforce the monitoring. Likewise, when we try to find efficiencies during 2023, we elaborated an internal procedure to standardize the stages and the alert management. Although the deadline for issuing the alerts is a very efficient deadline in the system, I'm glad to inform that by 2024 this indicator has been reduced even more, despite the number of alerts continues to grow. This is an evidence of our procedure complying the purpose it's been established for. At present, we can see the need for reaching the public and the consumer who wishes to know specialized information in terms of product safety. And this is why the working plans, the service safety has an agenda for 3 open training sessions yearly. In 2022, we conducted 3 training activities requested by the citizenship and also some other activities organized by the authority. We permanently issue recommendations for the safe use, for the disposal of the product, so they can prevent health problems from happening. In relevant dates, we do some press releases, podcasts, on TV and radio. In 2024, we have issued recommendation of more than 10 topics in different dates. And we have identified certain activities a year, for example, the Children's Days, Roads Day, Halloween, Shopping Day, Black Friday, among others. In addition to this, it is important to say that international relation activities to us are crucial in order to foster the joint solution of the common problems we face, as well as to promote innovation and inspire internal changes. We take part and we are beneficiaries of various projects that have been executed in different areas where many of you present here work in those forums jointly. On the other hand, we consider it is indispensable to reinforce the activities after the publication of the alerts. In a study we've been working, we already have some preliminary results stating that in 8 months' time after the alert issues, some progress have been made in 53% of the affected units. After that deadline, we do not have, sincerely, conclusive data, but we already have we have already mapped a need for accompaniment, for reinforcement by the consumption authorities so that suppliers they respect their responsibility and they comply with it. In this chart, we can see that out of the alerts issued in 2022, as I have said, only 53% of the products have been attended. The automotive industry is the highest, is 29% of the attentions, which is worrying and requires special attention. It has motivated that this year video conferences we held has been focused specifically on the automotive sector, and it's there where we have issued periodical or daily recommendations around safety. I will conclude because I'm running out of time. In this chart, we are depicting that one of the aspects that is crucial to us facing suppliers, how to issue what we call a warning, which is this communication suppliers give to consumers. We observe that despite that, massive communication has been considered more subtle and more effective when it's done through suppliers' portal, their establishments, as well as a direct communication. And it has led us to work hand in hand with the Congress on a norm which has been passed yesterday legislation, or before yesterday. To conclude, we consider that we shouldn't miss basic aspects such as the audits, fines. Between 2016 and 2023, our audit unit has conducted 329 audits. Among them, we have observed that 23% of the cases had ended in a recommendation to start administrative procedures. The most investigated behavior between 22-23 are when not communicating the authorities, and the execution, implementation of mitigation measures. These results are an evidence of the need for reinforcing the information given to suppliers so they know their responsibilities and they can comply with that by giving timely information. 29-23 period, 12 sanctions or fines have been executed. They reached 16 point, which is the value used to calculate the fine. This is around $26,000. The average of fine is 3.25 ETS. Sanctions were against the 4 specific suppliers, and the most final sanction factor was related with the fact of not informing consumers within 5 days. It is important to mention that the Consumer Protection and Audit Unit is the organ in charge of the actions implemented with warning activities in order to try to modify the supplier's behavior, which is a priority in our opinion when facing the effective protection of consumers. Thank you very much, and I'm open. I'm sorry if I spoke more. Thank you very much.
Thank you so much, Katia, for your presentation. And now we're going to move on to the second presentation, which is preventive alerts and on clinical records. It's the experience of COANIQUEM. It'll be presented by Carmina Domic Cárdenas. She is a nursing graduate, and she's the subdirector of the Corporation of Assistance to Burnt Children, and she leads educational campaigns, and she's a coordinator of international training programs on the matter, and she's part of research teams and an author of many publications in that specialty. She also is a teacher in Universidad Mayor. Hello, good afternoon. I think it's already that time. It's a pleasure to be here, and I thank CERNAC for the invitation. I am representing those of us who report incidents in the healthcare sector, which is another area and another manner of identifying or raising alerts. My institution, the Corporation for Assistance to Burnt Children, is mainly focused on rehabilitating young people and children who have suffered scarring or injuries due to burns or sometimes other ways. We rehabilitate, we research, and we teach people on these specialty. But here, what brings me here is what we do when it comes to prevention, and what strategies we employ to achieve this objective. First of all, we educate the community. This is a constant and permanent process to reduce burns. Massive campaigns, which is, as you well know, a very important way of reaching out to people and educate them to reduce these kinds of incidents. And the third stage is that is always a long-term goal. It's not very well known. It's not what people are very familiar with. This is one of the things that we do to prevent this, is product safety associated to burns. And at the same time, we also contribute our vision and our knowledge towards the development and modification of regulations and also laws. To give you a little bit of context, we need to know that worldwide, 9 million lesions produced by burns happen every year. That translates into a loss of 7.5 million years of life expectancy adjusted by disability. In Chile, we have 80,000 children that get burned, 20 years or younger. The economic costs of prevention are inferior to the ones of the damage that happen, and burns, we need to remember, are very grievous. And the investment that we need to spend on rehabilitation is much more than the one we do on prevention. And for us, burns are not accidents because they can always be prevented. And if it can be prevented, then it's not an accident. And this is what we try to transmit to the communities so people can take more active measures. The World Health Organization gives us burn prevention strategies, and they call upon us mainly to identify problems And by identifying them, we need to know the risk factors that produce burns on children and young people. And with this, of course, generate evidence and also find innovative and promising ways of performing interventions. And this is why we're here today, to show you the work that we have done in regards of diminishing burns related to consumer products. What happens to us? We are healthcare providers. We receive the patients once they've already suffered damage by something related with a product. What's important for us is to look for that. It doesn't automatically reach us. We need to ask the families, the people that suffer the damages. And that is done by healthcare professionals in the context of what's called an anamnesis, clinical consultation that is registered. And that could be there, lay there dormant, and nothing would happen. We need to take this information and use it actively to promote change. What do we ask? We asked about the products associated to the burns. And here we can see a lot of them, plenty of them. Most of them, you can see them in almost every household. Hot objects, hot liquids, heaters, and products. Products that can be more or less safe and can mean damage to our families. One example, for example, how has safety been improving when we're talking about electric kettles? We can see how they can produce burns because the receptacle turns over and the liquid pours out, and that's what produces the burn. Over time, they have become safer, since a very, very old electric kettle that you can see that has a very long cable that connected to the power, and that had the children play with it, get hooked on it, and it was very easy for the kettle to tip over and produce burns. Then later we had this other one that was not dismountable. The entire system was there. So now we have one that the vessels are dismountable, and the latest modifications in these products to make them safer was incorporating, at least in Chile, the regulation that the cover of the kettle needs to be an anti-spill cover. So even if the vessel tips over, it won't spill out. So we can see that adding the labeling that we have for all the products in the market that meet these characteristics, there are also the actions that accumulate and improve the safety of the products that we find available for the community. And we continue making them safer. Here we have an accidentability report from 2022 where we participated as an institution providing our data, and where you can see reflected that associated products to child accidents. We can see over here, unfortunately, our patients that have gotten burned by contact with heaters, with hair irons, with clothes irons, bikes, pools. This is a domestic matter that needs a lot of awareness by the population, and all these products that are identified there, they need to be changed, and this can always be improved further. Another example that I want to share with you has to do with something that comes up from medical consultations when a child shows up with burn marks. And we ask them, how did he get burnt? And they say, no, a glue tipped over. The nail, fake nail glue, a drop fell on him and he got burnt. How could that happen? Glue doesn't burn. It's an adhesive, a chemical substance. And we perform an investigation, and turns out that this glue has xenocrylate, that once it enters contact with cotton, it produces a chemical reaction that creates flame and heat. What do we do with that? Not only taking care of the child and taking care of their burns, we contact CERNAC and we say, hey, we had this child that had suffered this case, another child, and another child, we need to do something. CERNAC gathers the information that says, all right, and they make a decision. They contact the health ministry, they see things through the public health ministry, and having a conversation with people outside of the Public Health Institute, they let me know that starting in 2023, there was a change in regulations when labeling these products. So that makes us very happy, because that means less children getting burned by these chemical reactions. Another example to share with you has to do with regulations and laws, which is the work that COANIQUEM has been doing for many, many years. That has to do with the records and what we identify when tending to patients, the importance and how serious it was a few years ago, the burns due to pyrotechnics or fireworks. And by making this evident, showing the evidence, after a lot of intersectorial work, a law is passed where they prohibit the domestic use of fireworks, and then the cases of burns associated to that diminish greatly. They, of course, haven't been completely eliminated because there's other entities and there's contraband. There's still a lot of activities around that, even though they're forbidden. We continue receiving children with burns because, as I mentioned, this is a permanent work. This also tells us that we cannot be complacent. We need to always be alert on what is happening around us. So just to wrap things up, when it comes to burn matters, we need to gather data, we need to generate records, we need to identify the dangers, and that will lead us to the construction of information. Without information, there's no data. Without data, there's no knowledge. And without knowledge, there are no changes. So that's how can we effect the changes that we want to see in the world. Thank you so much. Thank you, Carmina. And now the next presentation will be reviewing the product safety, diminishing the risk of intoxication. That will be presented by the Dr. Juan Carlos Ríos. He is an executive director of CITUC. He is a pharmacologist and director of the toxicology unit of the Universidad de Chile, and he's also an academic at the Universidad Católica de Chile. Well, good afternoon. Thank you so much for the invitation. Thank you so much, CERNAC, for inviting us here to participate with you all. I hope I can stay on track with time. This is a pretty big challenge. This is 9 minutes and 45 seconds to do a presentation. I think that it speaks well of Karina. That's how her presentation lasted. That's how long. I direct the toxicology center, and just like Karina, unfortunately, we're at the back lines where we get the main problems. We get the intoxicated people, the people that have been exposed, that have suffered the lesions or injuries. You used to rely on fax and phone. That's your contact information. But now I put my Twitter and Instagram. I don't really use them, but they look very nice. You're not going to see me dancing on TikTok or anything. I use it academically, and what we do there is we position alerts that we use also with the toxicology center. The center also has its own Instagram. And here we place alerts that we see, for example, with marijuana. That's already shown up here, and we post it. I used to say upload a PDF, but today the kids call it a post. I am trying to adapt to the culture and new technologies. Nobody understood me when I said, did we upload a PDF? Oh, you mean to say the post? We uploaded the post. Okay, yes, that's what we're going to do. And then we uploaded it. So we have that communication system with our followers. That's what you call them now. It's no clients, it's followers. We did not reinvent the wheel. The center was created by Enrique Paris. Some of you are going to be familiar with the name. I hope it leaves a good impression. He created this. He brought the idea from the United States. He didn't reinvent anything. He said, okay, the U.S. has a toxicology center. Chile should have one. And he made one in 1992. And since then, we have been growing and developing. It's a center that attends people 24 hours a day. It's free, 7 days away, 365 days of the year. It's a continuous service. And if you're not being attended to, then just let me know, because they should be up at 3 a.m. as well. We take care of people. We hope that people that are parents don't call us. I hope that you don't call us. We want you to have the number, but we really hope you don't have to call us. It's a center that has been evolving, of course. I took this slide here yesterday of the leading products that are not products for consumption, but are medication, unfortunately, because these tend to be more dangerous. You can see here group number 1 is Ketiapine. Almost none of you are familiar with Ketiapine, but we have 2,500 cases this year, 33,000 cases total of and we're probably going to reach 35,000. Here, the only domestic product that never leaves the top 10 is chlorine. Chlorine is a classic. That's why I'm not a fan of chlorine. Chlorine will always be there. It was number one during the pandemic because we all got desperate in pandemic. We bought a bunch of chlorines and disinfectants. Anything that you mentioned that you killed any sort of bacteria or virus, we put it everywhere. We even sprayed it on our children, on the doors. We were putting all these blue, colorless, odorless liquids. And of course, chlorine was number one during the pandemic because of the disinfection rush. So now we have our center that tends to people. We have several centers. We're gonna receive 85,000 calls this year. That's normal. That's not normal. The number should not be going up. Logic dictates that the number should be going down, or at least reach a certain average, a standard, but we keep growing. Maybe because there's more things available now. I know that some of you are going to feel identified with this, especially the people that are with me. People love the Chinese malls, so they bring a ton of things home that they purchase there, and that's where problems comes up. I have nothing against the Chinese people, but I am warning you. We have 35,000 calls projected for this year. And 2023, there were 33,000 cases. And most of these cases, we get called from emergency services, which is not good because they should call us from home more than from emergency services, because then the problem is much more serious than if they called us from a house. For example, a mother saying that the little child ate the silica gel envelope. A lot of presents and things that you buy have that little silica gel envelope, and at 2 a.m. I ask you to pick them up because at 7 a.m. when the kids get up, they're going to eat it. The silica gel envelopes. The idea is that you don't call us once you're in the emergency. You want you to call us before that. But look, when all the incidents happen, most of them happen at home. 96% of them happen at home. Eventually, the largest amount of things, the largest preventing factor is us at home. So I think it's important to take that into account. Who are most exposed are babies and toddlers that are still being breastfed. I am not great at math. That's why I have my numbers, people. But you can see 45% adults. But if you look at the rate, the adults, that's all of us. Toddlers are much less numbers-wise. So by incidence, we have 1,000 cases for every 100,000 toddlers, and that's much more than the 50 for every 100,000 adults. So that's why they are the ones that are most exposed. One problem that I always have in all my presentations, it doesn't matter, it has nothing to do with this, it's an alert that keeps smothering us, is more than half of our calls are suicide attempts. Post-pandemic, it has been terrible. Half, even a little bit over half of our calls has been because of suicide attempts. It used to be 30, now it's 50. We hope that this year it'll stabilize and start going down, but I manifest this because I think it's a matter where we can all help. We could have a future health minister here, a future minister of finance, and maybe this resonates with you and you want to take action. But today is a problem for all of us. Like 1 out of every 2 calls is a suicide attempt. And these are our groups, the 4 most important groups. The first one, of course, is medications, 77%. Then I have cleaning products at 7.5, then chemical products, and then pesticides and plaguicides. These are the 4 most common products. Why? The center works very well as an alert mechanism because medications, there's not that many alerts that you can make. I think that there are several parents here. How do you give them the Tylenol drops? You just squeeze the vial, squeeze the vial, and the drop doesn't come out, but you continue squeezing. But it has not been expressed that the drop mechanism wants the droplets to be slow so you can count them. But the parents who are in a rush, we want the 20 drops out there right away, and if we keep squeezing, that'll make it work quicker. We believe that, and then it turns out that the child ends up being overexposed, over-ingesting the medication, and that's why the droplet thing, no, we want 20 drops, but no, you rush it, and that's an alert that we detected there. I don't have a lot of time, but I remember there was a product that had iron in it. The iron is absorbed very poorly in the body. You could give him a great volume of iron, but since it was absorbed so slowly, it's not very toxic. But there's a very clever company that said, okay, iron to 100%. That was a problem. It absorbed everything. What was good ended up being a problem for us because it intoxicated the child. And sometimes we parents don't read instructions, and sometimes companies don't even explain the instructions well. When it comes to cleaning products, what can I tell you about cleaning products? I remember one of the cases where we could alert on, but here we have all the chlorines, the floor cleaners that we make them. We make them very colorful. They even look pleasant. One of them even added lemon peels, and we said don't add lemon peels, otherwise children are going to believe that it's lemon juice. Remember the chlorine that had the skull on it? If you drink a little bit of chlorine, it had a sign that said poison. Now the children see the skull and they think it has to do with Pirates of the Caribbean. It's a perception thing. These are cleaning products. When it comes to chemical products and raw materials, I'm going to pass on to the next slide. Here for us, this is the worst alert that we have, was liquid silicone. If you remember liquid silicone, maybe a lot of you bought it because in school they had it as required materials, liquid silicone. Even some schools put the brand because that was a good brand, until there was one child who died. And when that child died, we asked, they asked me, I was very close to that case when I contacted the press. They said, is liquid silicone toxic? No, you can eat a lot of, I'm talking about silicone as a substance. So they gave me the safety data sheet, and I said, look, the safety data sheet was like a weird concept back then. It didn't matter too much, and I received it via fax, so you can tell how old this was. I called the company and said, hey, you're wrong. You send me the ethanol sheet and I want the liquid silicone sheet. And they said, no, that is liquid silicone, 50% methanol. And of course, methanol was forbidden at schools. We didn't even need to legislate that. You can't take alcohol substances into school, but the product was there on the list. Today, basically, they don't have it. There you can see 50%, 45% of methanol. 15 milliliters, and it's lethal on a child, not even toxic. 15 milliliters is lethal. Now, what are we facing? We're facing this other problem. This is a product bought at a mall. I'm not going to say which one, so you guys don't think I have an agenda. And here you have it, 990 pesos, 2,300 pesos. This is a plague control substance. This is a pesticide. If someone eats it, they ingest it, I have no idea what it is. And maybe in the back, and this is why I congratulate CERNAC, because it's the one that allows me to go and realize if they're wrong in labeling. Since they don't have the label, the first road that we can take as beyond healthcare is through CERNAC, because they don't comply with labeling requirements. And from there, we can start seeing what's wrong. Because when we're talking about a pesticide or a plaguicide, they need to fulfill a lot of more requisites. It's hard for this product to be at a mall that can be sold so easily. We could, like the same way we buy bug spray. I don't know what other brands of bug spray there are. So this is where we leave our concerns today, because we don't know what that is. Thank you so much.
Thank you very much. We'll go for the last presentation. It's called Applications of Social Marketing, the Prevention of Burns, presented by Alan Mackern, COANIQUEM Chile, Director of International Affairs, working to expand the international presence of the institution and consolidate the leadership in Latin America, cooperated in the OAS recommendation for the domestic legislation in relation to the legislation for fireworks and in the Americas. Also work with international civil organizations to strengthen international collaboration, passionate for teamwork in order to generate significant work, and the safety of the consumers. That's social marketing. Hello, thank you very much. Thank you to Sir Nak for having me and the audience. Let me show my presentation. All right, here it is. My name is Head of International Affairs, Director of COANIQUEM. This is the corporation supporting the burnt child. Carmina knows about this because we work together. We are in the healthcare line of business. I'm going to talk about social marketing, and the first thing I want to show you is about a survey made in the United States to more than 200 decision makers, and the question was, you as decision makers, what tools do you have to have an influence on the population behavior to contribute toward well-being, social well-being? What are those tools? And out of those 200 decision makers, 79%, representing more than 45 states, says education. Education is the tool we use, and we know it works, to change population behavior and leading it to something safer. There is 60% of those decision makers who believe that the regulations on the laws are the way to modify that behavior and transfer it to social well-being. 60% say, okay, we'll do more strict laws, and 45% okay, let's create new laws, and that will modify the population behavior, and there will be more safety. The question is, would you change your behavior? And I will only change my behavior, well, not only me, but many of us, if we perceive a benefit behind it when it comes to changing the behavior. Then when population faces this dilemma, there are different ways to react. And these decision makers from the prior survey refer only to two of them. They talked about a population who needs to be shown the type of behavior they need to implement to safeguard or protect their health. There is another group of the population that they need coercive activities to change their behavior. But there might be something else. Look at the chart. It's just an illustration, but 16% on the left will receive information and they will change their behavior for a safer one. And a 16% on the right will change their behavior because it's requested by law. What's the vision out of it? This is real, it's not my invention. The example on the left is how we respond before education. It's very easy. I'm from Argentina. I live in Chile. I have lived in Chile for more than 8 years. We have people from different countries here. And if you have a dog and you go dog walking, then you should clean your dog's waste. There are ways to convey that message. You can see that notice on the street that says, okay, your dog's waste is infectious. Okay, I take notice of that and I say thank you for letting me know. I will never leave the waste of my dog on the street. But there's another approach, and that would be through there's another methodology or method. There are people responding to laws. If I see you in the park and you let your dog leaving the poo there, you will receive a fine, a huge fine, and that will result in having clean parks. But many people from different countries are here, and we have all seen a dirty park or sidewalk, and these approaches are the ones used. So what's the alternative? What's the option? We need more than words. Not only tell that person, you know, your dog's waste communicate diseases, or you will receive a fine. Let's stage this out. If I am quickly working between 2 Zoom meetings, I live in an apartment, I'm in a rush because I need my second meeting, my dog wants to urgently go out, I take the call on the cell phone and I forgot the bag. What am I gonna do? Will they fine me? No. Then the social marketing says, okay, please clean your dog's waste, but since I know you forgot your bag, I'm giving you this bag. And that's what social marketing does. What we want to do is to decrease the barriers to implement a behavior and give motivation to change the behavior for something that's safer, cleaner, or better. In the end, social marketing is a strategic planning process. There's nothing new about it, but it applies the marketing tools, marketing mix, to change a behavior in favor of social well-being. It might be healthcare, environment, sustainability. Social marketing can provide tools in benefit of that. This is a short example, since we are here from COANIQUEM. This is a problem occurring more than a decade ago. Burns because of oven spillage. What was detected through an alert is that children in those 5 years, stand up in the oven door, and the whole pots or the whole things over the cooker top spill the boy, causing burns. I'm gonna tell you how the social marketing can contribute for a future approach. First, we have to define the problem. Burns was the goal. Reduce those goals in people under 5 years. How are we going to do that? We will focus in working with people who install kitchens or ovens. Then we need to start detecting what's our target audience. In this case, that target audience will be mother, father, head of the household, or probably a plumber. Well, installing that kitchen, because clearly by installing that kitchen, by using just a screw, where we attach this to the wall, that's a means of protection. Then we will specifically focus on the target audience, which has kitchen, cooker installers, and then we need one more thing. What are the barriers so that target audience change that behavior? And I picture this. I bought an oven in Mercado Libre. I opened the device, I put it there. Okay, that's ready. I gotta go. All right, that would be a barrier. I'm not doing my job well. I'm not dedicating to taking the time to correctly installing. Or I open the box with a anchorage system. There is a bag there with an anchorage system. And then I wonder, what is this? Those are barriers. And we need to know those barriers for the behavior we want to implement, which is attaching kitchens to the wall. We need motivators identification. One more step. We'll try to encourage the person who implements this, and this needs to be designed. This is why a strategic planning process. That person will attach the kitchen or the oven to the floor or to the wall, and after that they will say, okay, I finally adapt, ensuring my family safety, or a plumber or a mother, ensuring everyone's safety. And that experience is an aspirational one, and that needs to be designed. So this is a goal. So we can see some other tools which may be given by social marketing. In point 7, what we have to do goes beyond. Let's specifically think that's how social marketing can help me. We need to design a product, a place, a location, and then comes the promotion. How are we going to promote it or advertise it? The main product in this example, the one we're talking about, is a safe cooker. Tangible. What are we talking about? I'm talking about an anchorage system, or a kitchen with an anchorage system included. One more thing. Extended product with a video, including the instructions or the explanation how that can be correctly done or safely done. And besides, a testimony video with a mother, a father, with someone with burns due to kitchen spillage tells that story. This is working with marketing, product, price. We don't have to think about economic things all the time. Perceived cost. What is the price our targeted audience perceives to change that behavior? Place where I'm gonna put this. If it is video, I can post it in YouTube. If I am talking about kitchen product, it might be kitchen centers, Sodimac, a big hardware store. We need to start thinking to design that better, because that's where people we want to work with are. Then we have, as any other project, we got an assessment plan, establishing a budget and implement an action plan. How can we do that? How can we do to know that this approach, which probably, and I've been listening to all the talks today, and I noticed there is a strong focus in laws and regulation. I think it's very important and necessary, but the goal of this talk is to show you that there are other alternatives, but we need some data for those alternatives, and they are not always available. They like a census data, but sometimes we need more information to know who we need to work with and what are the keys we need to press so that people in the end take safe behavior. That is it. Thank you very much. Thank you very much to the speakers. I think this is very interesting on how presentations reflect this idea of having information, having data, and that data generate information, and that can be connected to reflection. There are certain processes which are pretty evident, such as the one of issuing alerts. They are necessary, and I think they are well articulated. But probably there are other things where we may have some progress and challenges on the use of information, for example. Specific in relation to healthcare matters, healthcare data well regulated. Most part of the legislation considers that sensitive data. However, their use is allowed when it is legal or when there is a public institution who wants to use that and they require the use due to their function compliance. And I think that's a pretty good bias to think on how we can grant access to healthcare data for this specific use. They don't necessarily need to be nominal, but we need to identify the person, what generates this safety risk. It can also be anonymous data, but allowing to add information and make decisions on health, public health. That will be the first line. And under the framework for personal data protection, that's being considered the data access when that's legal and being considered in public functions. And I believe that's a very interesting method. The other one, which I think has more technological difficulties, but it is also possible, is clinical information access in a safely and regulated manner, but doing this clinical records use valuable information. And there are also interoperability strategies allowing the generation of those mechanisms. They should be, it's not a simple process, but we have in Chile the legislation to do that. Thanks to the panelists, and we'll now continue with the next panel.